Hello, in this video, we're going to answer the practice questions about production pharmacology. Question number 1. These are agents added to the animal feed in order to enhance the feed conversion efficiency in terms of increased formation of muscles, fat, and bones. Letter A, growth hormone. B, growth promoter. C, beta-adrenoreceptor agonist. Or D, antimicrobial growth promoters. The answer is B, growth promoter. Growth promoters are substances that are added to feeds as supplements or injection to improve feed utilization and growth of farm animals. Question 2. These are used in adult ruminants. A, growth hormone. B, growth promoter. C, beta-adrenoreceptor agonist. Or D, antimicrobial growth promoter. The correct answer is D, antimicrobial growth promoters. They have provided benefits to the agricultural industry by increasing production efficiencies and maximizing livestock health. The use of antibiotics for growth promotion has risen with the intensification of livestock farming. Question number 3. It is a peptide hormone not to be used orally. A, growth hormone. B, growth promoter. C, beta-adrenoreceptor agonist. Or D, antimicrobial growth promoters. The answer is A, growth hormone. The main reasons for the low oral bioavailability of peptide drugs are pre-systemic enzymatic degradation and poor penetration of the intestinal mucosa. Question 4. Muscles and fat cells are rich in these receptors whose activation promotes muscle formulation and prevents muscle breakdown at the cost of adipose tissue. Letter A, growth hormone. B, growth promoter. C, beta-adrenoreceptor agonist. Or D, antimicrobial growth promoters. The correct answer is C, beta-adrenoreceptor agonist. Beta-adrenergic agonists that are known to promote growth, improve the growth rate, and feed conversion of sheep and poultry. These drugs have also been shown to decrease total carcass fat and to increase total carcass protein in all 4 animal species. Question 5. It is ineffective in poultry and promotes milk production up to 20%. A, growth hormone. B, growth promoter. C, beta-adrenoreceptor agonist. Or D, antimicrobial growth promoter. The correct answer is A, growth hormone. Insulin taken in oral form would be broken down in the digestive tract just as any other protein is broken down and would not be effective. If protein growth hormones were given orally to chickens via the feed, they would be broken down in the digestive tract and rendered ineffective. Question 6. It is not clinically used in food animals due to severe side effects and adverse meat quality. A, growth hormone. B, growth promoter. C, beta-adrenoreceptor agonist. Or D, antimicrobial growth promoters. The correct answer is C, adrenoreceptor agonist. The most consistent effects are increased proportion of lean meat. However, the effects on meat quality vary with compound used, dosage, duration of treatment, and species. Certain compounds have been reported to decrease tenderness of meat in cattle. Question number 7. A kind of steroid hormone growth promoters that acts through the stimulation of production of growth hormone and insulin-like growth factor. A, clenbuterol. B, testosterone. C, zeranol. Or D, estradiol. The correct answer is D, estradiol. Estradiol is a steroid hormone made from cholesterol and is the strongest of the 3 naturally produced estrogens. It is the main estrogen found in women and has many functions, although it mainly acts to mature and maintain the female reproductive system. Question 8. A SHGP that promotes muscle mass by stimulating protein synthesis. A, clenbuterol. B, testosterone. C, zeranol. or D. Estradiol? The correct answer is B. Testosterone. Testosterone increases neurotransmitters which encourage tissue growth. It also interacts with nuclear receptors in DNA which causes protein synthesis. Testosterone increases levels of growth hormone. Question number 9. A SHGP that suppresses oestrus and promotes growth. A. Progesterone, B. Testosterone, C. Clenbuterol, or D. Estradiol? The correct answer is A. Progesterone. Progesterone is primarily responsible for preventing pregnancy. The main mechanism of action is the prevention of ovulation. They inhibit follicular development and prevent ovulation. Progestin keeps the cervical mucus viscous so sperm cannot enter the uterus and fallopian tubes to fertilize egg. Question number: Estradiol is given through a dosage of A. 10 mg with 200 mg progesterone or testosterone, B. 20 mg with 200 mg progesterone or testosterone, C. 20 mg with 200 mg progesterone or testosterone, D. 40 mg with 200 mg progesterone or testosterone. The correct answer is B. 20 mg with 200 mg progesterone or testosterone. Question 11. The answer in item number 10 is effective for how many months? A. 1 month, B. 1 to 2 months, C. 2 to 3 months, or D. 3 to 4 months. The correct answer is D. 3 to 4 months. Estradiol is effective 20 mg with 200 mg progesterone or testosterone for 3 to 4 months. Adding testosterone or progesterone to estradiol helps in slow release of estradiol. Question 12. Why are diethylstilbestrol and hexestrol, both synthetic non-steroidal estrogens, not used? A. It is ineffective, B. It is costly, C. It has harmful side effects, or D. It has residue problem. The correct answer is D. It has residue problem. DES has an ability to induce abortion. DES should not be used in pregnant pets and should not be handled by pregnant women. DES should be not used in females with mammary tumors or other estrogen-responsive tumors. Question 13. They act through beneficial alteration of ruminal microflora and proportion of volatile fatty acid production. A. Ionophore antibiotics, B. Non-ionophore antibiotics, C. Bacterial antibiotics, or D. None of the above. The correct answer is A. Ionophore antibiotics. Ionophore antibiotics decreases acetate and methane production and increase propionate production, which enhances feed conversion efficacy. Question 14. It helps in dry matter digestibility and in improving nitrogen utilization. A. Ionophore antibiotics, B. Non-ionophore antibiotics, C. Bacterial antibiotics, or D. None of the above. The correct answer is A. Ionophore antibiotics. For example, in diets containing a high concentration of readily fermentable carbohydrates, ionophore generally influence feed efficiency by improving or maintaining body weight gain and reducing feed intake. Question number 15. It helps in improving the health and production of livestock through beneficial alteration of ruminal or intestinal microflora. It is also used in ruminants and poultry. A. Non-ionophore antibiotics, B. Non-ionophore antibiotics, C. Bacterial antibiotics, or D. None of the above. The correct answer is B. Non-ionophore antibiotics. These compounds are used to selectively modify microbial populations within animals to improve production efficiency and to maintain health by combating low-level infections, particularly in intensive production system. Ionophore antibiotics are added at blank levels in ration. A. 5 to 30 ppm, B. 10 to 30 ppm, C. 15 to 30 ppm, or D. 20 to 30 ppm. The correct answer is A. 5 to 30 ppm. Question 17. These exert nitrogen-sparing action, making more available amino acids for protein synthesis. A. Ionophore antibiotics, B. Non-ionophore antibiotics, C. Bacterial antibiotics, or D. None of the above. The correct answer is B. Non-ionophore antibiotics. Antimicrobials may have a nitrogen-sparing effect, thereby increasing the availability of amino acids to the animal to support growth of economically relevant tissue depots such as skeletal muscle. Question 18. Their extensive use of feed supplements is discouraged due to risk of emergence of bacterial resistance to antibiotics. A. Ionophore antibiotics, B. Non-ionophore antibiotics, C. Bacterial antibiotics, or D. None of the above. The correct answer is B. Non-ionophore antibiotics. There is circumstantial evidence that use of subtherapeutic doses of antimicrobials creates selective pressure for the emergence of antimicrobial resistance, which may be transmitted to the consumer from food or via contact with treated animals or animal manure. Question 19. An example of these are probiotics like lactobacilli, streptococci, or yeast. A. Anabolic steroids, B. Therapy of milk fever, C. Microbial growth promoters, or D. Therapy of ketosis. The correct answer is C. Microbial growth promoters. Probiotics are live microorganisms included in the diet of animals as feed additives or supplements. They are commonly known as direct-fed microbial. Probiotics provide beneficial properties to the host, primarily through the action in the gastrointestinal tract of the animal. Question 20. Synthetic derivatives of androgen testosterone, but different from androgen in that these have more of anabolic actions and less of androgenic effects. A. Anabolic steroids, B. Therapy of milk fever, C. Microbial growth promoters, or D. Therapy of ketosis. The correct answer is A. Anabolic steroids. Anabolic steroids, also known more properly as anabolic androgenic steroids, are steroidal androgens that include natural androgens like testosterone that are structurally related and have similar effects to testosterone. Question 21. It aids in establishing beneficial intestinal microbial population. A. Anabolic steroids, B. Therapy of milk fever, C. Microbial growth promoters, or D. Therapy of ketosis. The correct answer is C. Microbial growth promoters. Microbial growth promoters promotes fermentation and formation of lactate and checking multiplication of pathogenic bacteria, which improves digestion and thus feed efficacy. Question 22. A metabolic disease occurs in high-yielding lactating cows due to impairment of calcium homeostasis. A. Anabolic steroids, B. Therapy of milk fever, C. Microbial growth promoters, or D. Therapy of ketosis. The correct answer is B. Therapy of milk fever. Milk fever, also known as hypocalcemia, usually occurs within 48 hours of parturition. This happens when large amounts of calcium are removed from the blood and utilized in the mammary tissue or production of colostrum. Question 23. It acts through stimulation of nuclear receptors, triggering the specific enzyme formation, causing enhanced synthesis of muscle proteins. A. Anabolic steroids, B. Therapy of milk fever, C. Microbial growth promoters, D. Therapy of ketosis. The correct answer is A. Anabolic steroids. Anabolic steroids upregulate and increase the number of androgen receptors, thus enabling the increased training intensity and indirectly contributing to increased muscle size and strength. Question 23. This disease can be treated by registering calcium in the affected animal. A. Ketosis, B. Milk fever, C. Hemoglobinuria, or D. Hypophosphatemia. The correct answer is B. Milk fever. Early stages of milk fever can be treated by administering calcium orally. Later stages may need intravenous calcium. Timely treatment is important, or else the cow may die due to circulatory failure or respiratory collapse. This disease leads to impaired glycolysis and erythrocytes. A. Ketosis, B. Milk fever, C. Hemoglobinuria, or D. Hypophosphatemia. The correct answer is D. Hypophosphatemia. Hypophosphatemia is a condition in which your blood has a low level of phosphorus. Low levels can cause a host of health challenges, including muscle weakness, respiratory or heart failure, seizures, or comas. Question 25. The following are treatment of hypophosphatemia except A. Blood transfusion, B. 300 ml of water solution containing 60 gm of sodium acid phosphate, C. Oral feeding of 200 to 500 gm bone meal, or D. None of the above. The correct answer is oral feeding of 200 to 500 gm bone meal. The treatment compromises blood transfusion, 300 ml of water solution containing 60 gm of sodium acid phosphate, and oral feeding of 100 to 120 gm of bone meal. Question 26. This disease is also called asectonemia in cattle and pregnancy toxemia in sheep. A. Ketosis, B. Milk fever, C. Hemoglobinuria, or D. Hypophosphatemia. The correct answer is A. Ketosis. Ketosis is a metabolic disorder yielding in cattle and buffalo, which occurs when energy requirement of the animal exceeds the energy intake, which results in negative energy balance. This condition occurs due to low blood glucose level. Question 27. The following are side effects of anabolic steroid except A. Masculinization in female, B. Increased libido, C. Clitoral atrophy, D. None of the above. The correct answer is D. None of the above. The side effect includes increased libido, testicular atrophy, azoospermia in males, anestrus and clitoral atrophy, masculinization in females, and retention of sodium and water, and hepatotoxicity. Question 28. Hypophosphatemia leads to impaired glycolysis and erythrocytes causing high ATP formation. A. True, B. False. The correct answer is A. True. Hypophosphatemia leads to impaired glycolysis and erythrocytes causing low ATP formation, which in turn disrupts the structural integrity of erythrocytes, resulting in hemolysis. Question 29. This disease occurs in high-yielding lactating animals in pregnancy lactation cycles or post-parturient period. A. Ketosis, B. Milk fever, C. Hemoglobinuria, or D. Hypophosphatemia. The correct answer is A. Ketosis. Ketosis is a metabolic disorder that typically occurs within 2 weeks post-calving. After calving, the demand for milk production increases substantially and are unable to consume adequate energy to sustain performance, causing them to be in a negative energy balance. Question 30. Hypophosphatemia is aggravated by what deficiency? A. Copper deficiency, B. Selenium deficiency, C. Both A and B, or D. None of the above. The correct answer is C. Both A and B. Copper and selenium deficiency aggravates hypophosphatemia. Question 31. An example of beta-adrenoreceptor agonist. A. Testosterone, B. Estradiol, C. Clenbuterol, D. Monensin. The correct answer is C. Clenbuterol. Clenbuterol is a substance that has steroid-like effects and is classified as a beta-2 adrenergic agonist. Clenbuterol is a fat-burning drug that raises the metabolic rate. Question 32. An example of antimicrobial growth promoter. A. Testosterone, B. Estradiol, C. Clenbuterol, D. Monensin. The correct answer is D. Monensin. Monensin is an antimicrobial growth promoter. It is specifically an example of ionophore antibiotic. Question 33. An example of anabolic steroids. A. Stanozolol, B. Lactobacillus, C. Clenbuterol, or D. Monensin. The correct answer is A. Stanozolol. Stanozolol is an example of alkylated anabolic steroids together with oxymetholone. Question 34. The following are growth promoters except A. Microbial growth promoter, B. Non-steroid hormone growth promoter, C. Steroid hormone growth promoter, D. All of the above. The correct answer is B. Non-steroid hormone growth promoter. Steroid hormone growth promoter, growth hormone, beta-adrenoceptor agonist, antimicrobial growth promoter, and microbial growth promoter are the example of growth promoters. Question 35. Babermycins, virgianamycin, and zinc bacitracin is an example of what drugs? A. Microbial growth promoter, B. Ionophore antibiotics, C. Steroid hormone growth promoter, or D. Non-ionophore antibiotics. The correct answer is D. Non-ionophore antibiotics. These drugs help in improving the health and production of livestock through beneficial alteration of ruminal or intestinal microflora. It is used in ruminants and poultry. Question 35. Which of the following is an example of ionophore antibiotic? A. Bambermycin, B. Actinomycin, C. Salinomycin, D. Virginiamycin. The correct answer is C. Salinomycin. Salinomycin, monensin, lasalocid, and maduramycin are the examples of ionophore antibiotic. Question 36. Treatment of ketotic cows consists of administration of glucose and glucocorticoids. A. True, B. False. The correct answer is A. True. Orally administered propylene glycol after initial use of dextrose or glucocorticoids has given excellent results. Question 37. Probiotics does not exert growth promotant action in ruminants. A. True, B. False. The correct answer is B. False. Probiotic does exert growth promotant action in ruminants by improving its digestion and thus feed efficiency. Question 38. Non-ionophore antibiotics feed supplementation as growth promotant is discouraged. A. True, B. False. The correct answer is A. True. Non-ionophore antibiotic feed supplementation as growth promotant is discouraged due to its risk of emergence of bacterial resistance. Question 39. There are two types of anabolic steroids. A. True, B. False. The correct answer is true. The two types are alkylated anabolic steroid and non-alkylated anabolic steroid. Question 40. Anabolic steroids should be used in feedlot animals. A. True, B. False. The correct answer is false. Anabolic steroids should not be used in feedlot animals because of its residual problems. Question 41. Growth hormone promotes milk production up to what percent? A. 20%, B. 30%, C. 40%, or D. 45%. The correct answer is A. 20%. Question number 42. What dosage of nandrolone decanoate is given to dogs and cats? A. 0.5 mg per kilogram via intramuscular once in a week. B. 0.5 mg per kilogram via intravenous once in a week. C. 1 mg per kilogram via intramuscular once in a week. Or D. 1 milligram per kilogram via intravenous once in a week. The correct answer is C. 1 milligram per kilogram intramuscular once in a week. Question 43. What dosage of baldenone andecyclinate is given to horses? A. 0.5 milligrams per kilogram via intramuscular every 3 weeks. B. 0.5 milligrams per kilograms via subcutaneous every 3 weeks. C. 1 milligram per kilogram intramuscular every 3 weeks. D. 1 milligram per kilogram subcutaneous every 3 weeks. The correct answer is C. 1 milligram per kilogram intramuscular every 3 weeks. Question 44. Ionophore antibiotics is given in how many levels in ration? A. 1 to 30 ppm levels. B. 2 to 35 ppm levels. C. 5 to 30 ppm levels. Or D. 6 to 35 ppm levels. The correct answer is C. 5 to 30 ppm levels. Question 45. Calcium borogluconate is given at a dosage of 150 to 250 milligrams per kilograms via blank IV. A. Slow. B. Fast. C. Very slow. D. Very fast. The correct answer is A. Slow. Question 46. Non-ionophore antibiotics exert calcium-sparing action, making more available amino acids for protein synthesis. A. True. B. False. The correct answer is B. False. They exert nitrogen-sparing action, not calcium-sparing action. Question 47. Estradiol and testosterone are examples of steroid hormone growth promoters. A. True. B. False. The correct answer is A. True. Estradiol increases both muscles and fat by the production of growth hormone and IGF-1. Testosterone promotes muscle mass by stimulating protein synthesis. Question 48. Growth hormones is effective in poultry. A. True. B. False. The correct answer is B. False. Orally administered insulin will be broken down in the digestive tract in the same way that any other protein is broken down, rendering it ineffective. If chickens were fed protein growth hormones orally, their digestive systems would break down and render them useless. Question 49. Which of the following is a synthetic steroid drug? A. Zeranol. B. Hexastrol. C. Melangestrol acetate. Or D. Diethylstilbestrol. The correct answer is C. Melangestrol acetate. Melangestrol acetate and trenbolone acetate are the examples of synthetic steroid. Question 50. Ketosis occurs due to the impairment of energy metabolism characterized by the following except A. Hemoglobinuria. B. Hypoglycemia. C. Ketonoma. Or D. Ketonuria. The correct answer is A. Hemoglobinuria. Hemoglobinuria is characterized in hypophosphatemia.